Alrighty, ladies and gentlemen, good afternoon. Bernard Harris with the Pikes Peak Strategic Group and the Ameriplan Corporation. One very contentious topic that comes out every day or no less than every other day is healthcare coverage and insurance. And to kind of give you an idea, that old saying, a picture's worth 1,000 words, newspaper here. Amazon, Buffett, JP Morgan, pick head of healthcare firm. Another article, different date, lower costs, fewer benefits, and new healthcare insurance option presented by our current administration. They're talking about insurance. Nobody is talking about discount healthcare. There is a difference. You decide what you want, but having been involved in discount healthcare for over 10 years, I will tell you this is something that you need to take a hard look at. We have put together a fact sheet. I will send it to anybody that wants to email and ask about it. And I challenge folks to challenge us about the validity of the information. If it's not true, I will not tell you. If I make a mistake, I'll let you know. But this is something that you can get for your household. For $39.95 a month, ladies and gentlemen, you're going to be able to get dental, vision, prescription, chiropractic, and telemedicine. Now, I'm going to have my partners explain to you how those benefits can help you for $39.95 a month. Bill, what do you think?
Yes, good afternoon again, everyone. Bill Gamble, Pikes Peak Strategic Group. We should make it clear, I think, guys, that we are not trying to deter people from purchasing insurance.
Absolutely.
Right. If you need insurance, by all means, purchase it.
I agree.
What our program does is kind of cut your healthcare cost needs, whether you get that through paying directly yourself or through your employer. This program helps you save money on healthcare. That's the bottom line. We talked about Dental Plus program. Dental Plus gives you vision support, which all of us need when you get my age. The Dental Plus gives you a vision program. It's called Plus because it does have a vision supplement. It does have a chiropractic supplement. It does have a prescription drug supplement. That's Schedule D that a lot of people are filling out. They're spending money that you don't have to spend on health care. And so our programs actually, we're not speaking against insurance. We're saying take advantage of these programs to reduce your overall health care cost. And the deluxe program for $39.95, again, includes the telemedicine, it includes the prescription drug program, those benefits that most of us as seniors will need anyway, whether you pay through the nose to an insurance company. If you need to do that for other benefits, certainly we will encourage you to do that if you need insurance. But everything, I won't say everything, but most things you can get at a discount these days, particularly for those essential things that we just spoke about. So why not take advantage of this program, the Deluxe Plus plan that Ameriplan offers, and the Dental Plus program that is offered, because we all need health care.
Without a doubt.
But most traditionally we've gotten that from an employer.
Oh yeah, most of the
An
time.
employer has provided, but those days are gone. Employers are not providing total health care as they once did in the old days. So now we need a separate vehicle for vision, for dental, for many other things, because the package deal where you could work 40 years for a company and get a gold watch, and the company took care of you for 40 years until you retired. Those days are gone. There are many options. Now it's a marketplace. It's a market-driven healthcare industry. And so what we have to offer is ways to reduce your overall health care, not just for you, but for you and your entire household. Where can you get for $24.95 a month total care for vision, dental, chiropractic, prescription drugs for your entire household?
Yep.
Where can you get that kind of deal? So it's a way to reduce your overall health care cost.
Right.
the glasses I'm wearing it's part of an $800 package that I paid less than $400 for me and my wife.
Right.
You know, and so had I had to pay the original price, it would be close to $1,000.
Oh, yeah.
And so these programs minimize your overall healthcare cost, and that's what we're trying to do: educate people on
Right.
the need to minimize their costs.
Right, and if I may intervene at this point, excellent information, Bill. And once again, I want to get back talking of what Bernard mentioned, talking about insurance. All three of us have insurance. So once again, I want to put that out there that I think every person should have insurance, health insurance for their family. And there's a lot of options out here. But one of the things that the traditional insurance companies aren't doing, what Ameriplan has been at the forefront, is hospital advocacy. And what is hospital advocacy? Let's give an example. A person doesn't have any health insurance, and he run up a bill, say of $1,500 or more, with the Ameriplan $39.95 program. You can get a professional negotiator to come in and negotiate your bills, old bills as well as relevant bills. So what is one of the biggest causes of bankruptcy these days? It's health care bills, ladies and gentlemen.
Yes.
And if you've got family members or friends or colleagues in your family or around town, they're always mentioning, or a few of them mention about old medical bills. Ameriplan does a great job with our professional group called the CARES Group. So if you have those old medical bills, or you know you're going to have some recent hospital stays, you can contact our consultants, the CARES Group, and they'll work out a way to, in your particular state or city to get you connected with a hospital and serve as an advocate to find out what the best price could be for your service. So we offer a lot of things where traditional insurance does not. And we serve as a supplement to help American families. So I just encourage you to take a strong look at the Ameriplan Corporation and some of the our medical plans. We're not insurance. I always like to throw that out there, but we act as a supplement to your regular insurance, and it can help you with out-of-pocket expenses. So once again, if you have questions, there's information at the bottom of this video. Get a hold of us at our 1-800 number, and one of three of us will be happy to talk to you and educate you on the things that will help you and your family. Thank you.
Yeah, let me say one thing about hospital advocacy. Not too long ago, I had to assist a person in selling an estate. There were hospital bills that were being billed against the estate. It would have been nice had that person had this program where they could have reduced those hospital bills. Again, as Ed just said, you have an expert organization, the CARES Group, who will look at those hospital bills to make sure what is charged, what is the should-be cost.
Right.
You won't be paying $100 for 81 milligram baby aspirin.
Right.
You have someone who will look at those bills to make sure they are adjusted to be what they should cost. And again, it was an unfortunate situation, but all of us would have an estate to be settled at one time or another. But it would have been nice if this person been able to subscribe to this program, to have those bills looked at to make sure that they were should cost, and the bill against the estate would have been reduced
Yes.
to what it realistically should be. And
Excellent.
we have seen, hospital bills, $100,000 is probably the minimum. Especially for people who have very serious issues, very detailed and serious cutting-edge surgeries that require specialists of every kind. Those are the kinds of bills that most folks can't cover with their insurance plans. Or at least there's some limitation, some cap on that. So it's good to have an expert eye looking over your shoulder to look at those bills to make sure they are what they should be. And that's what our hospital advocacy plan does. You have to have a bill that's over $1,500. If you have a hospital bill that's over $1,500, that qualifies you to have these experts look under look over those bills and make sure they are where they should be. But you must be a member, you must be a subscriber of AmeriPlan. So either one of our plans, the Deluxe Plan, the Dental Plus Plan, or both, qualifies you to have that service provided. So if you have a hospital bill that's over $1,500, you're eligible to have that addressed. So thanks very much. Please call and ask us questions if you have any, and
Yes.
we will certainly try to
Absolutely.
address them to the best of our ability.